Salicylate poisoning, often caused by an overdose of aspirin or other medications, can lead to serious health complications, including damage to your body's acid-base balance, respiratory distress, and even organ failure. In today's video, we'll walk you through the essential steps to recognize, diagnose, and treat salicylate poisoning, ensuring the best outcomes for affected patients. Salicylates are a group of chemicals found in many medications, most commonly in aspirin. While small doses of aspirin are used for pain relief and heart health, an overdose can overwhelm your body's ability to process the drug. When too much salicylate builds up, it disrupts key metabolic processes and leads to toxicity. So what are the key signs of salicylate poisoning? Symptoms can vary depending on the dose and time since ingestion. Early signs include nausea, vomiting, dizziness, and tinnitus, or ringing in the ears. As poisoning progresses, the patient may experience rapid breathing, confusion, dehydration, and in severe cases, seizures and coma. One of the hallmark effects is an acid-base imbalance, where patients often have both respiratory alkalosis and metabolic acidosis. Let's break that down further. Diagnosing salicylate poisoning relies on a combination of clinical evaluation and lab tests. A key test is measuring serum salicylate levels, with toxicity typically occurring above 30 mg per deciliter. However, it's not just about the numbers. Lab results need to be interpreted in the context of the patient's symptoms and acid-base status. Other critical tests include arterial blood gas or ABG to monitor pH levels and electrolyte levels to check for dehydration and metabolic disturbances. Initial stabilization and supportive care. The first step in managing salicylate poisoning is to stabilize the patient's vital signs, addressing airway, breathing, and circulation. Dehydration is a common issue, so intravenous fluids are usually administered to support blood pressure and electrolyte balance. Correct acid-base disturbances by giving sodium bicarbonate, 1,2-meg, to alkalinize the blood and urine, which enhances salicylate elimination. Serum alkalization can be stopped when the following criteria are met. 2 levels show that the salicylate level is consistently decreasing. Salicylate level, 40 mg/dL*. The patient is asymptomatic with a normal respiratory rate. Following discontinuation of alkalinization, it may be reasonable to follow labs for 4 additional hours to ensure that acidosis doesn't recur, especially in chronic toxicity. Monitor for hypokalemia and replace potassium as necessary, especially if using sodium bicarbonate therapy. In some cases, if the patient has ingested a large amount within the past hour or two, activated charcoal can be given to absorb any remaining salicylates in the stomach. Dose is 1 g per kilogram, up to 50 to 100 g in adults. Gastric lavage, considered for patients with large ingestions and within 1 hour of ingestion, though it is generally less common. Specific treatment, alkalinization. Once stabilized, the next step is to focus on enhancing salicylate elimination. One of the most effective treatments is urinary alkalinization using sodium bicarbonate. This increases the pH of the blood and urine, which helps to trap salicylates in the urine and accelerate their removal from the body. Patients are closely monitored for blood pH levels to ensure that the treatment is working without causing additional imbalances, such as systemic alkalosis. Severe cases, hemodialysis. Indicated for severe poisoning or in cases of renal failure, pulmonary edema, persistent acidosis, or salicylate levels. 100 mg/dL in acute poisoning or 60 mg/dL in chronic poisoning. Hemodialysis is the most effective method of rapidly removing salicylates from the bloodstream, especially when other treatments fail. It is also indicated for patients with severe symptoms like pulmonary edema, renal failure, or confusion. Monitoring and recovery. Throughout treatment, it's crucial to continuously monitor the patient's serum salicylate levels, blood gases, and overall condition. Repeat serum salicylate levels every 2-4 hours until levels decrease and clinical symptoms improve. Continuously monitor ABG, electrolytes, and glucose levels. Also watch for pulmonary edema, cerebral edema and seizures, and renal failure. Regular blood tests help determine whether salicylates are being effectively eliminated and whether further interventions like additional sodium bicarbonate or dialysis are needed. Recovery depends on the severity of the poisoning and the timeliness of treatment. With early intervention, most patients recover fully, but severe cases may require prolonged supportive care. Prevention. Preventing salicylate poisoning starts with education and safe medication practices. Aspirin, especially in large doses or when combined with other salicylate-containing products, can be dangerous. It's important to always follow dosing recommendations, store medications securely away from children, and consult a doctor before combining medications. In summary, salicylate poisoning is a serious medical condition, but with prompt diagnosis and appropriate treatment, patients can recover fully. If you found this video helpful, make sure to like and subscribe for more health-related content. And not forget to like, comment, and subscribe.